Welcome back to the You Empowered podcast. I'm excited for today's episode because I am joined with Caren from Empower Me Fitness. Caren specializes in helping mums rebuild their strength, their pelvic health, and their confidence. Caren, welcome. I'm so excited for you to be here today.
Thank you. Thank you for having me. I'm excited.
Yeah, I'm excited too. Before we dive in, do you mind just telling everyone a little bit about your journey and what you'd like them to know about you and the work that you do?
Yeah, absolutely. So I am a personal trainer and I specialize in helping mums with pelvic floor dysfunction. Yeah, my story starts way back. I guess I've always been active, always playing sports and things like that growing up. I studied exercise science at uni, did my Cert 3 in fitness after that, and worked in a gym for a little while. But way back then, I wasn't as confident. I was pretty shy and then decided to travel the world. So I kind of moved away from the gym and exercise stuff, but still worked in like healthcare admin, primary healthcare, and things like that. So then fast forward to getting pregnant and starting my own family, I kind of realized, well, I still want to be active, but I don't know what to do. And everyone around me was saying, oh, you got to look after the baby. You don't want to lift anything too heavy, anything like that. So my first pregnancy, I didn't do a lot of exercise at all. And postpartum, I fully believed that at that 6 week mark, I would be back to normal. And that it was, yeah, far from the case, to be honest. So months
Wow.
down the track was when I guess started to feel a little bit more normal. Um, and I found a gym that supported mums specifically. So started to do some exercise, was feeling way better, and then got pregnant again. So my second pregnancy looked completely different. I worked out up until I gave birth pretty much. Like if I didn't go into labor on the Monday, I would have been in class on Tuesday. So obviously adapted, but felt really good, way better in that pregnancy because I was just moving a lot more.
Yeah.
And the postpartum experience was a lot different. I was, back at that like 6 to 8 weeks, progressively at, increasing my exercise and what I was doing. I was back to running. I was super mum. I was pushing a double pram and running half marathons and yeah, felt amazing
Wow. What a difference
until,
between the first one and the second,
yeah,
right?
yeah, definitely. Yeah. But then, then I developed after one of my half marathons. I felt a feeling like I had a tampon in that was like falling out, and I'm like, this isn't normal. This feels weird. And I had, checked in with my midwife, trying to find out. I mean, I diagnosed myself with Google that I had a prolapse, but didn't really know what to do after
Wow.
that. So I eventually, found some help, but I just really thought that I should have known a lot more considering my background in, study and work experience. So at that point as well, the mum that was taking the classes that I was attending, she decided to move on and asked if I wanted to take classes. So that sent me down a huge rabbit hole of just learning way more about the pelvic floor, pelvic health, post or pregnancy and postpartum exercise. Because I thought if I don't know these things with my experience, then there's so many mums out there that have even less knowledge about all of that, and the pelvic floor dysfunction can really significantly impact your life. It doesn't have to be your new normal, like everyone tells you that it's just another part of being a mum. But so I guess
Yeah.
that's that's the summary of how I got to this point. And now I've been working in that space and continually learning and educating myself to try and improve the lives of mums to prevent
Yeah.
pelvic floor dysfunction or support women to manage it and still live active lives. Yep.
Absolutely, absolutely. What an incredible story. And how, I love how you shared like how your first pregnancy was so different to your second and that movement really helped you. But it sounds like when you found out that you had a prolapse, was that quite like soon after your second birth, or was it quite a long way away? Like how did that come about?
It was 1 year postpartum.
Oh wow.
So,
Okay.
knowing what I know now,
Yeah.
I would have done things a lot differently, but I
Yeah.
just didn't have that knowledge. So, you're given a handout when you after you've given birth, and it's got some pelvic floor exercises on it. My midwife talked about doing Kegels, and I would do it, and I thought, oh yeah, I've got this. I do it every now and then when I remember, but I really didn't understand the changes that your body goes through during pregnancy and the birth process, whether it's a C-section or vaginal birth.
Yes.
How your posture changes, the effect of hormones and breastfeeding and all of that. So really understanding those changes and how it can impact your pelvic floor or your body in general can really help you with a more positive return to exercise, because you might feel okay, but if you're feeling okay and then step it up maybe too quickly, then you're going to get injured or develop some pelvic floor issues that
Yeah.
you could have potentially prevented if we just did things a little bit differently.
I'm so excited to delve into this with you today because I'm just like, my brain's just like, yes, like all the things. Um, so perhaps we should start because I do have a lot of questions around that and exactly what you said,
Yep.
like what you would have done differently and all of that. I want to deep dive into that with you. But I guess because you've lived this journey, like how, like going back to that, what would you have done differently and how did you rebuild your pelvic health and your core strength and your fitness and your confidence as well in yourself in that process?
Yeah, I think what I would have done differently was really had a better understanding of the impact of my pelvic floor and how I could, work on that strength, because it turned out I didn't have really good pelvic floor strength in the end. And that constant impact from running over and over again, especially running and pushing a double pram just over time, when I wasn't strengthening that area, it was just putting more pressure on my pelvic floor. There's probably a genetic factor as well. But I didn't find out that my mum had experienced prolapse until I mentioned that I had experienced that, and that can be a factor as well. So again, it just really comes down to education, and then
Yeah.
that progressive overload um, to your return to exercise. So it's not just you reach, the 6 week mark or the 3 month mark and right, you're good to run. You need to be understanding that your pelvic floor and deep core strength, rebuilding that up, and then rebuilding the other supportive muscles and general strength to support whatever activity you want to do, and then that gradual return to that activity. So it's not like, right, I've been cleared to run, I'm going to run 5Ks. It's like you've been cleared to run, you can go for a 20-minute walk and you might run for like 30-second intervals within that. Do you know what I mean? So whereas I was just running because I felt good and I just kept running. So,
Yeah. Yeah.
and
Because
built
no one
up my
told you any
pace.
different. So you're like, why
Yeah,
not?
exactly. Yeah. So I guess that's what I would have done differently, is just, had a more structured programming or idea of how to progress into running. Um, how I did eventually do that though is I saw a women's health or pelvic floor physio, and I didn't know they existed back then. And a lot of people don't know that there's these amazing people out there who specialize in the pelvic floor and pre and postnatal and all those changes. So having their an assessment to understand what's really happening for you, because we're all different, we're all unique, we all have different ways our bodies move and our anatomy and all that stuff. So it's understanding what's happening for you and then building on that. So
Yeah.
to start off with, it was building up strength in my pelvic floor, and that was a 12-week program, just so I could
Mm.
hold my pelvic floor contraction for 10 seconds. So it was a slow process, and
Mhm.
I was told not to run. I was told not to lift over 5 kilos, which was really not great when I had two kids under two. So
Oh, that would have been
um,
difficult. Yeah.
yeah, definitely. So I did wallow a lot for a while, and just did the pelvic floor exercises, but didn't do a whole lot of other exercises because I didn't really know what I could do. Um, and then I just delved down the research and education side of things. I thought, well, yeah, I'll do what my physio is telling me to do, but I'm also going to learn more about it. So, and then the more I would learn, I would be like, oh yeah, I'll apply that. And one of the things that I learnt was posture. Like the way I was holding myself most of the time was just putting more pressure down on my pelvic floor. I was like hunched over, and it just meant that my pelvic floor wasn't able to work as well as what it could have. So,
Mm.
um, so yeah, I just applied different things and gradually built up to being able to run again with the support of the physio. But at that point, a lot of it was trial and error.
Yeah.
myself.
Yeah.
I know now there's a lot more support out there for that more progressive um, exercise or getting back into exercise after you've been diagnosed with prolapse. So
Yeah.
yeah,
Wow.
it took some
Incredible.
time, and definitely took a mental shift as well. So
Yeah.
instead of thinking about, oh, I can't run, I just feel really bad because I'm not running, that was like my outlet,
Mm.
mentally, and started focusing on what I could do. So, okay, well, I can't do that. That's okay. I may get back to it. We'll see. But what can I do right now? And that was like that core retraining, that pelvic floor exercises. I can get in the pool and do some exercise or do some swimming. So, yeah, it's that gentle shift. And that wasn't overnight. That took a long time to get to that point. But I
Yeah.
guess it's true with a lot of injuries is that we often focus on what we're missing out of or what we can't do. But if we can
Yeah.
shift that energy and put it all into, well, what can I do? Then you're going to make that progress a little bit quicker as well.
Yeah, and it makes such a difference to your mental health because, as you say, if you're constantly looking at what you're missing out on or what you can't do, that's
Yeah,
just a negative spiral, like a downward spiral. But as you say, if you're able to focus on, okay, did I improve this week from last week?
yeah,
Could I hold my pelvic floor for like 1 second more or something? Like just
yeah,
looking at those
exactly.
positive changes
Yeah,
that help you, like, okay, I'm making progress. This is temporary. I'm not going to be in this position forever.
yeah,
Yeah, yeah, because I was going to ask you about the mental health side of things and how you shifted that. So it was more focusing on what you could do day by day and week by week and
yeah.
focusing on that. Is that what? Yeah.
Yeah, definitely. And accepting that it was going to be a slow process,
Yeah.
because it was
Yeah.
the initial 12 weeks of just my strength, improving my strength for my pelvic floor. But then
Yeah.
it was also like I had really weak glutes, which, I've always had really weak glutes. Weak transverse abdominis, like just, I don't even think that ever worked well for me my whole life, thinking back now, but understanding that, like, this is a muscle that works this way, it supports your pelvic floor, so we need to make sure that that's strong and switching on in the right way,
Yeah.
to support you when you're doing movement as well. So yeah, it was shifting that expectations around, I'm going to get back to this by a certain time, and just allowing the process to happen, focusing on what I could do and giving it the time that it needed. Yeah.
Absolutely, absolutely. And just for any women listening to this right now who may not fully understand the terms that we're using or the terminology, would you mind just sharing, if we just take a step back a little bit, what pelvic floor is, what pelvic health is, what does
Yep.
prolapse mean? You mentioned transverse abdominis, all of those little things. Would you mind just briefly sharing that just for any woman who's like, I've heard of pelvic floor before, but I'm not really
Yep.
sure what that all means? Yeah.
Yeah, sure. So, yeah, your pelvic floor muscles are a group of muscles within the pelvis, and they support your bladder, bowel, and uterus. So they hold up those organs to keep them up inside, and they're responsible for bladder and bowel function and sexual function as well. So our pelvic floor is the base of our deep core system. And our deep core system involves our diaphragm. So our breathing affects our pelvic floor as well. It also involves our transverse abdominis, which is that deeper abdominal layer. So we've all probably heard of like your rectus abdominis, your six pack muscles, your obliques, but then underneath that is the TA or the transverse abdominis, and that co-contracts with our pelvic floor. So our diaphragm, our TA, and our pelvic floor all work together to manage intra-abdominal pressure.
Wow.
So we want to make sure that we can use our breath and to help with our pelvic floor as well, and that TA activation. So it's helpful to understand that they don't just work in isolation; they work as a whole system to support us through our movement. So if we can understand that, then we can start to then apply that to the exercises and the movements that we do. So it's not just doing your Kegels, which you've probably heard. Yes,
Mm.
it's good to have pelvic floor strength, but how is that then working with your breath, with your deeper core activation when you're, going about your daily life?
Yeah, absolutely. And also understanding how like a tight pelvic floor, which is what I like found out that I had when I went to see my women's health physio
Yeah,
post-op, and how that impacts your movement and your breathing and how you can so maybe for those listening, is there one thing that you could share from a breath perspective that would
yeah,
help any woman listening who's like, okay, I want to learn how to engage my pelvic floor? Because I know like we've heard it say like the Kegel exercises and things like that, and people
yeah,
end up just bracing their core muscles and not
yeah.
actually activating their pelvic floor. Would you mind just sharing like even one or two things that would help a woman listening today to actually connect with her pelvic floor and actually start activation with that?
Yeah, definitely. So, first of all, well, actually, I didn't mention prolapse before or explain it as
Yes,
well. So
yes. I was going to circle back to
I'll explain
that.
that, and then I'll come back to the connection breath.
Yes,
So
yes.
prolapse is when your bladder, bowel, and/or uterus drops down into the vaginal cavity. So there's varying stages of that as well, and one in 50% of women will experience some degree of prolapse over their lifetime,
Wow.
but not all of them will be symptomatic. But I mean, if we just think about gravity
Yeah.
over time, so with prolapse, it's not just about your um, muscles, it's the connective tissue as well. So you can have a really strong pelvic floor, but you can still have a degree of prolapse because that connective tissue is stretched, and it's a lot harder to improve that or build that back up again. So even if you do have prolapse, the pelvic floor or Kegel exercises can really help. However, you want to be also focusing on the rest of it, the breath and the surrounding muscles to help support your pelvic floor as well.
Wow.
So, going back to our pelvic floor contraction,
Yeah.
there's also research out there that says 50% of women who think they are doing a pelvic floor activation correctly are not. So we want to think about it's the muscles within the pelvis. Say you're sitting on the toilet and you're weeing, but you're trying to stop the flow of urine. It's just
Mm.
those muscles. So you shouldn't feel your butt muscles come on. You shouldn't feel your abs come on and get really tight. It's just that little movement down within the pelvis. Um, and we want to be, or it should be working with our breath. So when we breathe in, our lungs fill with air and our diaphragm comes down. Our pelvic floor relaxes to allow for that diaphragm to come down. When we breathe out, our pelvic floor contracts and our diaphragm comes up. So it's working together to manage that pressure within our abdomen. So an easy, and then our TA should co-contract with your pelvic floor. So when your pelvic floor is contracting, your TA should be turning on, and when it's relaxing, it should be relaxing as well. Sometimes though, or for a lot of women, after they've gone through pregnancy and birth, that connection gets a bit lost. It's a little bit harder to explain over a podcast. So
Yeah,
I'll
of course.
stick with just the pelvic floor and diaphragm
Yeah, of course.
connection. And we will think about being in an elevator, and we do not want to fart. We're going to hold in a fart. Okay. That's my cue today.
It's
So,
a great visual.
yeah, yeah, exactly. So you're going to breathe. Just first of all, take a nice deep breath in. Everyone's often like, cool, tense.
Yeah.
Nice deep breath in. And then we're going to think about when we're breathing in, we're actually relaxing through our belly, through our pelvic floor. As we breathe out, our pelvic floor is going to contract and lift up. So we're holding that fart in now. And then the doors open and we can relax.
Ah,
So we're breathing in and relaxing. We're breathing out and we're squeezing and lifting up. So breathing in and relax. Breathing out, switch on that pelvic floor. We want to draw up and in. So some people will squeeze but be pushing down. We want to try, and another way to think about it is imagine you're sucking up, a milkshake through a straw through your
yeah.
vagina.
Yeah,
So
yeah.
you're lifting, drawing it up.
Or
So there's
the
lots of,
tissue one, I've been like
yeah,
sucking up
the
the tissue.
tissue
Yeah.
one, the blueberry one, yeah, there's a lot of different cues and for your pelvic floor and TA activation, and some will just resonate with you better. But yeah, the main thing is you want to be thinking about connecting it with that breath and making sure that you're not pushing down, and we're not switching on any of these other muscles. So our core, because it's quite often for mums to just be really tense through that those upper abs and not
Yeah.
be able to relax that. So yeah, that connection breath is a really good way to, lying down on the ground or even when you're in bed, just thinking about connecting that breath with your pelvic floor.
Mm.
And it doesn't need to be a really tight squeeze every time you're doing it. So
Yeah.
it's just getting that connection so it knows that when you go to do something, it should be switching on to for the appropriate level for that task as well.
That's incredible. I'm sure that already has helped listeners knowing they're going to be sitting there going, okay, like even I'm like sitting there breathing out, like connecting in, sucking up the
Yeah,
tissue.
well, a lot of
Right.
mums say to me, "Oh, I do it the other way," and it's
Yes.
just a habit
I
that
thought
you
it
get
was the other
into.
way before. I
Yeah,
thought that. I thought, yeah.
I think some Pilates or some exercise do it the other way for some reason, but it doesn't. To me, it doesn't make sense because
No.
if you're breathing in and squeezing up, you're putting like more
Pressure.
pressure.
More pressure. Yeah.
Yeah, so yeah, we think about it and we want to reset it to that way to
That's
manage that
incredible.
pressure for our pelvic floor.
That's incredible. That's incredible. Thank you for taking us through that. So, for any woman listening to this right now, and I understand that there might be someone who's maybe just found out she's pregnant, maybe she's, you know, in the middle of her pregnancy, maybe it's her first birth, maybe it's her second or third. Like, what would you want to share with her if she's never really understood pelvic health, pelvic floor, and really worked with either a woman's health physio or even just done anything to support herself with that? What are the, I guess, common misconceptions that women kind of think about when it comes to pelvic health, and what would you suggest for them?
Yeah, I think we think of Kegels and just squeeze, 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 but a strong pelvic floor is one that can move through its whole range of motion. So you need to be able to squeeze, switch it on, but also relax. Um,
Mm.
and symptoms of pelvic floor dysfunction, like leaking, for example, you can leak if your pelvic floor is too weak, obviously. But if your pelvic floor is too tight and it's not able to relax fully, then you can also experience leaking. So there is such thing as a hypertonic, tonic, or tight pelvic floor. And especially if you're going into your first pregnancy, it's really good to understand what your pelvic floor is doing. Because if you've got a really tight pelvic floor and you're thinking, oh, I need a strong pelvic floor, I need to keep squeezing it, then you're just going to make that worse and then it can impact your birth as well. So it's recommended if you haven't seen a women's health physio before, see one at around that 19-20 week mark to work out what's happening for you, and they can give you appropriate exercises to either strengthen it if it needs strengthening or help relax and give you exercises to help with the birth as well.
Incredible. Incredible. And what about if a woman's listening to this who thinks similar to where you were when you found out, okay, I think I've got a prolapse. What are the common misconceptions around prolapse? What would you recommend that she do? Like go see a woman's health physio, or what would be the steps? Looking back now at your
Yeah,
own journey, like what would you recommend a
I
woman take?
I would recommend all women see a women's health physio or pelvic health physio after they've had a baby. So before
Yeah, ideally
preconception, even
before.
during pregnancy. This is in an ideal world. During
Yeah.
pregnancy and postpartum. So you can get a really good understanding of what's happening in your body for you. And I say to mums, ideally, in my ideal world, we would have a lot more understanding about this area of our body, as we go through, learn about our bodies in school and things like that.
Yeah.
Because, we do associate pelvic floor dysfunction with childbirth and with mums. But with the increase in high intensity activity, there's a lot of people who haven't had kids that are experiencing um, dysfunction as well, just because of high
Really?
impact. Yeah. So that's my ideal world.
Yeah.
But at any stage, whether you're just about to have a baby, whether you've had a baby, you think everything's okay, if you can get a checkup, now is the perfect time because it will not only help you now, but if you have future pregnancies, when you get down into the perimenopause and menopause space where your hormones change again, that's another time in our lives as women that pelvic floor dysfunction, increases.
Yeah.
So having an awareness and education about it now and how to make sure that it's strong and functioning really well can
Yeah.
set you up for much more success later on down the track as well.
Amazing, incredible. So first step, whether wherever you're at, whether you're
Yeah.
just found out you're pregnant or you're not pregnant, whether you're like in the middle of your like pregnancy or even afterwards, go see a women's health physio. Uh,
Mm.
for because you just touched upon that point, would you mind sharing how hormones impact pregnancy, birth? And you touched on there, like how obviously, like in perimenopause and postmenopause, it has an impact as well. Would you mind sharing that so women can understand how, yeah, how their body's changing, I guess?
Yeah. So estrogen is a big factor. So for me, it was probably, again, another thing that led to or affected me getting prolapse. But
Yeah.
when you are breastfeeding, your estrogen is lower. So your tissues aren't, they don't have that protective effect of estrogen. So thinner, not as supportive. And then again, when you go through perimenopause, your estrogen dips as well. So it's just that strengthening effect that estrogen has on the tissues or supportive effect
Right.
reduces. So if you're aware of it and building up that strength and function, then you're at a much better chance. Yeah, you're in a better place for that not to impact you as much. So you still might have some dysfunctional experience, um, some symptoms, but it may not be as bad as if you did nothing about it and just got to that stage. Yeah.
Right, I see, I see. And is there a difference in how a woman should support her body, whether it's through vaginal birth or through C-section? Is there differences there that women need to understand around that?
In terms of a vaginal birth can, just because of the process, increase the risk of developing prolapse or dysfunction.
Okay.
However, um, all mums, whether you've had a vaginal birth or a C-section, you've been growing baby for 9 months, so you've got that additional weight pushing down on your pelvic floor for an extended period of time. So yeah, even if you've had a C-section, that's kind of a myth out there that I've had a C-section, my pelvic floor is fine. However, you've had additional weight pushing down on your pelvic floor. Your body has changed, your posture's changed, your muscles have moved around, shifted positions to allow for baby to grow. So how they used to support you or may not be how they're doing that now. So it's just understanding those changes that happen throughout pregnancy, birth, and postpartum, whatever experience you have, and managing your return to exercise. And I say return to exercise, but I mean like even just understanding how to move in daily life. Because as a mum, you
Yeah.
are, constantly carrying baby, feeding baby, holding baby, lifting heavy nappy bags, prams, capsules, all those things, moving in different ways. So I'm not specifically talking about going to the gym, but understanding how you can move to support you in every day.
Yeah. And is a woman listening to this right now, would she get that from going to see her woman's health physio, or is there anything around that? Like I know you mentioned earlier, posture was something that you discovered that you're like, oh
Yeah.
wow, like I'm leaning forward, that's putting more pressure on my pelvic floor. Is there anything for a woman listening right now that for her to consider or to be aware of outside of seeing a woman's health physio to support herself navigate her everyday life and her everyday movement
Yeah.
as a new mum?
Yeah, definitely. So there's some awesome free resources out there.
Mm.
So yeah, Women's Health Physio will be your gold standard because they can either do an internal or some really, they can do ultrasound, internal examination, or other assessments to get a good understanding of what's happening for you.
Yeah.
However, there's some just general advice and information that we don't know as women that would be really helpful. And working with a MumSafe trainer. So I'm a MumSafe
Mm.
trainer. We're kind of like the gold standard of trainers in the pre and postnatal space and
Yeah.
beyond,
Yeah.
because we've done the correct certifications for that. So we learn about posture, we learn about the knee pain, wrist pain, back pain, all the things that mums experience, and then how to help mums move in a way that's safe, but building that strength as well. So MumSafe Trainer, make sure that if you're working with a trainer that they do have qualifications in that space. Also, on the mumsafemovement.com website, there is a free return to exercise course for mums. So it goes through some of those things like the pelvic floor activation, the TA, understanding your body. So that's like, even if you don't have a trainer near you that's qualified, you can get some of that information to then move forward as well. I've got a bunch of free resources on my website as well,
Yeah.
empowermefitness.co.nz /freebies. So yeah, there's seeking out that information can be really helpful. And that, yeah, there's a few different options for you, but also be mindful of what you see on social media because
Mm,
there's a lot of
100%.
misinformation out there and people just trying to make money from this niche
Absolutely. Yeah, yeah.
without the genuine care behind it that trainers who really delve into this do. And as a MumSafe trainer, we have ongoing education every month
Yeah,
within the pre and postnatal and women's health space. So
yeah,
and if we know we can't help you specifically, then we know who to refer you to go,
yeah.
this person specializes in that. They can really help you. So yeah, it's all, we all collaborate together and we've got a wealth of knowledge behind us to help you.
Yeah,
Yeah.
absolutely. No, I love that. And for anyone listening, I will be putting Karen's details in the show notes. So everything you've just said there, if you just missed what she said, don't worry. Like I'm going to put it in the show notes. So we're going to have, your Instagram, your Facebook, your and website, Karen. So that's going to all be in the show notes so that if you're like, oh, where do I find that information? It'll be in the show notes. Have a look in the show notes after this episode. But yeah, to your point, it is so important to be mindful of what we take in on social media. Because as you say, like there's so many, I've seen it in the menopause space, but I've also seen it in the mum space. Anything that can be made a niche. There are so many
Yeah.
so-called fitness coaches or influencers jumping on, saying that they can help mums and they're completely not qualified in pre and postnatal training, or as you say, as MumSafe,
Yeah.
which is the golden standard. And when you actually ask them, okay, what are your qualifications in helping mums? They can't tell you because they don't have they don't have any
Well,
qualifications.
and your usual PT qualifications don't delve into it. I think now it's getting better. Like you may have some requirement, but it's only very, very basic. So,
Oh, the Cert 4 PT certification was so basic. Like it was
but
just
yeah,
like it was so
because I did
basic.
mine years ago. It wasn't even in there.
It was nothing. It was like, here's how you do a lunge. Like, no, but like it was
Right.
pretty basic. It was yeah.
Yeah. Well, if you think of two things come to mind, you'll often see, if you do these three exercises, you'll heal your diastasis.
Yeah.
And there's no one or two or three specific exercises that are going to heal everyone's diastasis.
Yeah,
So,
yeah, yeah.
um, working with someone who understands what abdominal separation is and how you specifically need to move your body to help with that, because again,
100%.
everyone's different. We move differently. Our So yeah, having a trainer that's able to go, okay, that one may not work as well for you, but I can give you this exercise, or if you just change it this way. So those generic things out there can help, but sometimes it could potentially make it worse, or you're just not going to get the benefit out of it. So
Yeah.
yeah,
And the problem with social media is it works very well on, as you say, on that kind of shock factor, like
yeah,
surface level content, but it's missing nuance, and nuance
yeah,
is what you're going to
definitely.
get, as well as like, personalized support with a MumSafe trainer and coach who can really look at exactly, your situation, your body, and put you in the right, in the right direction, so to
Yeah.
speak.
And we are more than just a couple of exercises, more than just our
Mm,
pelvic floor.
mm,
So
absolutely.
and I know you do a lot of work in the mindset space as well. So it's like we understand mums really well. So
Yeah.
we're not just focusing on getting a flat stomach. We're
No.
focusing on your mental health, your physical health, your emotional health. We're helping you to understand how to navigate motherhood and
Yeah.
move well in ways that are going to support you. Because some days you'll feel amazing and you'll be okay to do certain exercises. And then the next day you've had hardly any sleep, you haven't eaten well because you've had baby attached to you 24/7, and
Yeah.
you want to do some movement, but doing something really hard or high intensity is not going to help you. Like maybe you
Yeah.
just need a couple of stretches. So we definitely adapt and help mums learn how to adapt themselves, so their movements and exercise is going to support them through that journey or that process postpartum and into menopause as well.
Yeah, it's supporting the woman as her whole self, which is what
Yeah,
I talk about.
definitely.
Yeah, not just one
Yeah,
thing. Like it's not just body, it's not just muscles, as you say, it's not just fat loss or getting that flat belly or any of that. It's looking
yeah,
at the woman as a whole and supporting her as a whole because she is a whole being, not one thing.
that's
Um,
it. Yeah,
so yeah, so
definitely.
that yeah, that's incredible. That's so incredible the work that you do. Is there anything we haven't covered yet around prolapse, pelvic health, anything that a woman listening to this needs to know that we haven't gone through yet, Karen?
I think, yeah, I guess so. In terms of avoiding prolapse or managing prolapse,
Yeah.
it's not just about strength of our pelvic
Mm,
floor, like our hydration, avoiding constipation, so making sure that we're eating well, that we've got good bladder and bowel health can really help with those pelvic floor symptoms. It's moving in ways that are safe and feel good for you, like I mentioned before, at that particular time on that day.
yeah.
So being able to adapt and be flexible and modify things. Mums
Mhm.
with pelvic floor dysfunction may feel more symptomatic at certain times of the month.
Okay.
So it's managing your symptoms, understand, kind of just listening to your body and going, oh, I'm feeling a bit heavy today. Maybe I'll adapt this way. So you working with the physio and a trainer who's knowledgeable in that to help you be able to self-manage more,
Mhm.
and giving you the strategies to still exercise even if you are symptomatic. So you may shift it from your exercise from standing to in a seated position or lying down. You may increase your rest periods between your exercises or between your workouts.
Mhm.
And then there's different breath strategies as well. So, I mentioned before your breathing
Yeah.
can help, your pelvic floor is connected to your breath. So there's different strategies that you can use with your breathing while you're doing an exercise that can help build that strength, but not put so much pressure on your pelvic floor. So it's just understanding all of that as a whole.
Yeah.
There's lots of different ways that you can, but the worst thing we want is for women to go, oh, I leak or I've got prolapse, I can't exercise anymore. It's working
Yeah.
with the people that know
Yes.
how to support you with that so you can
Yeah.
manage it and still exercise. And I see it all the time on the prolapse Facebook groups that I'm in, like women just diagnosed and really, really like down and upset. And is this my life forever? And that's kind of how I felt initially as well.
Yeah.
But then there's other people who are like, yeah, well, I'm 5 years down the track and I'm back to running and I'm competing in like bodybuilding and things like that. So there's
Yeah.
definitely hope. And I
Mm.
think we need to encourage that in mums that, yeah, it can be pretty crap to start,
Yeah.
but let's work on it. Doesn't have to be your forever either.
Yeah.
Um, and we've just talked about, like conservative management, but there is surgery available as well.
Yeah.
Um, and that would be, a conversation with your physio, with your specialist about what is right for you. But
Mm.
even if you do need surgery, you want to make sure that your posture, your breathing strategies, your exercises, everything that you're doing is going to um, make that surgery way more successful. So
Absolutely.
there's a bit of a pattern that I see in the online groups, and I know a lot of it's in the States as well, but that it's like, oh, I've got these symptoms, I've gone straight for surgery, now what? And the surgeon will say, yes, you're cleared to exercise, but if they don't know how to manage, how to look after their pelvic floor and exercise in the right way, then that surgery is going to fail because they haven't addressed the initial problem that's, all that extra pressure down on your pelvic floor. So, yeah, keep people moving. Yes, you may need surgery, but you still want to be moving and understanding your body so that surgery is most successful.
Yeah, absolutely, absolutely. And what would you say for someone, because you mentioned in the Facebook groups, like there's a bit of a bracket of women who are, as you say, like 5 years post being like, yeah, I can run again and I can do all these things and it's great. And then there's women who have just found out they've just gotten the diagnosis that they've got prolapse and feeling down. What would you have wanted? What like looking back now at your journey in that moment when you got the diagnosis, like what would you wished you would have known in that moment?
I think that it wasn't forever.
Mm,
Um, and yeah, it's hard to know because um, mentally, like when I was experiencing that, and then when I saw my first physio, I don't remember the whole conversation. Do you know what I mean? Like,
yeah,
um, it was more just in my head, oh crap, I've got this. Now what do I do? Type thing. I'm not going to be able
yeah,
to do that. Like you're kind of spiraling in your head
of course.
um,
Yeah.
a little bit. So it was hard to know. However, there are certain things that I think would really help, and they're the basics like posture, your breath, understanding how to do your pelvic floor activations, and then how to incorporate that into your movement. So there's those basic things that don't always get given to mums, or mums don't really know, or they find out like like I did, like just along the way down the track. So um, I've put together a guide for specifically for prolapse that goes through that.
Incredible. Which
It's
they
not
can
on the
find on your
website yet,
socials.
but it's all ready to go. I meant to put it up last week, and then I had website issues, so it's a
Oh
little
no.
behind. But yeah, so it's just the basics. Start with those basics, and then you find someone that can help you progress from there. But I think a lot of people miss those things that they can do and work on that
Yeah.
will help them in the long run. And then just having that hope or that positive, yes, you will get back to this, or you can potentially get back to this if that's what you want to. Like, I don't run anymore. I play hockey. That's my extent of running, but I don't go run 21Ks anymore. But
Yeah.
that's more a decision that I've made
Yeah.
because in the stage of life I'm at, I don't have the time
Yeah.
to put into all the strength that I would need to do to support that running. So, I swim a lot more, I cycle a lot more. So it's just, there's a lot of ways that we can support women, talking about their mindset, talking about their goals, working with them, celebrating their successes along the way, and just supporting them a lot more instead of going, I know it's hard when you go to an appointment, you've only got a certain amount of time, but what I'm trying to do is say, well, hey, there's other people out there like myself, other MumSafe trainers who are experiencing this and can offer that more support um, when you're feeling low, when you've just, had that diagnosis, and to give you a little bit of hope that it's not all doom and gloom forever.
No, no, it's not. There is hope and you can, yeah, it doesn't mean, like it is how it is when you get that diagnosis and you're a living
Yeah.
example of that. So, and
Yeah,
there's many,
yeah.
many more women like that,
That's
which is
definitely,
incredible.
yeah.
Yeah, yeah, incredible. So, what would you say is, I guess, the from all the women that you've served and you've worked with, what would you say is like some of the most common mistakes that you see when women either return to movement, like once they've given birth or once they've had the diagnosis with prolapse? What are some of the like common mistakes that you see,
Yeah, I think,
and how to avoid them, I guess?
well, yeah, in mm, in terms of returning to exercise postpartum, I guess the mistakes is like you hit that 6 week mark. Your 6 week checkup is often not enough. So
Yeah,
yeah, it's kind of signaling your doctor or your GP. You may not even be checked.
yeah,
Some people I hear a lot more lately is that it's all just about the baby, and they'll ask, "Oh, how are you doing? How do you feel?" So
yeah.
there's that. But
Wow. So it's not
then,
even a proper checkup then.
no, not always for the women. Yeah.
Okay.
So you're like, yeah, you're cleared to exercise, but your GP and your midwife are not experienced in exercise prescription. So
Mm.
to them, they're like, yep, you're healing, you've healed well enough, like you've recovered physically from that birth, and now you can start to return to exercise. But it doesn't mean your body is ready to go back to what you were doing um, pre-pregnancy, or
Mm.
even into that pregnancy type thing. So everyone is different. It really depends on your experience with exercise, your pregnancy experience, your birth experience, your postpartum experience. So
Yeah.
everyone is so different. But I do talks to mums groups all the time, and I'll hear a lot of mums go, oh, I was feeling good, like I had a good sleep, I've slept all night, so I went for a run and then just felt like uncomfortable and realized it wasn't right. So you don't know what you don't know. So that's why I'm like, always on my little pedestal talking to mums about this,
Yes.
about,
Yeah.
education,
Needed.
education, education. The more you know, the more you can realize where to seek help, when to seek help, and what you can do to support you better. Um, that's probably the biggest mistake I see, is that women just get into things too quickly
Mm.
and too early, not realizing, like me, that your pelvic floor and your other muscles and how you're holding yourself is not supportive enough for what movement you're trying to do. The
Absolutely.
prolapse side of things is, I would say, the biggest mistake is people just going, uh, having that fear of exercise, or fear that they're going to make things worse, which is totally valid. I have that. I still have that sometimes where I think, oh, I don't know
Yeah.
if I should be doing this.
Yeah.
But yeah, it's just not doing anything because you just worried about it so much. But having good global strength will support your pelvic floor. So
Mm.
when you're doing those movements, you're supporting muscles like your glutes, your quads, core is going to be able to hold you better without that extra pressure going down through your pelvic floor. So movement is key, keeping active. However, finding the right people to help you guide you to do that safely so you're not going to make it worse.
Yeah, that's so important. And it's almost in a way, would you say, relearning your body?
Yeah,
Because
absolutely. Yep.
going back to what you said there with the mistake where women just think, oh, I can go back to what I was doing before. It's like you know your body then
Yep.
pre-birth or pre-surgery or and then it's like, okay, now like it's like yes, you're in the same body, but there's things that you need to understand about it to meet yourself where you're at. And as you say, like
Yeah.
support yourself on any given day based on how you're feeling, like what, you know, what's happening for you. Would you say that that was your process too? Was it was kind of almost like relearning your body a
Yeah.
bit? Yeah,
Yeah, absolutely. And from what I've learned about my body, like I used to swim a lot competitively when I was younger,
I love
and
swimming.
I just remember like not being able to do a crunch all the way up for ages, and then even after my first baby, the trainer did check for that TA activation, but I couldn't do it, and it didn't click until way later. And she's like, "Oh, well, maybe you're just doing this a bit differently or something, or I can't feel it
Mm.
enough." But yeah, then, down the track where I'm having some hip pain and I'm getting that investigated more, it comes down to I don't think I've ever been able to activate my TA properly up until now. So there's a lot of habits, I guess, that we get into in our movement patterns that we don't realize that that can impact us. So yeah, it's all about just learning way more about your body, understanding it more, so you can then do the things that are going to support you better instead of overdoing it, and things like that. And in terms of postpartum, us women walk around with, obliques switched on all the time because we're sucking our tummy in. But if that's the case, then we're putting more pressure down our pelvic floor. And when we
Mm.
try and do a pelvic floor or TA activation, all our upper body like switches on and tenses. So that's super common. And it may not be helping mums strengthen that. It's helping mums detrain that, like let's
Yeah.
bring it right down to something that's barely an exercise so you can feel when that pelvic floor and TA is switching on and then the other muscles are coming on, because you don't want all the bigger outside muscles to just keep working over when they shouldn't. You
Yeah.
want those deeper muscles to be supporting you first, and then the other
Yeah.
ones come in depending on the task that you're doing. So yeah, it's a lot of re-education, I think. And what worked for you in your 20s or early 30s may not be
Mm.
working for you now.
Yeah.
The way you recover may not be
Yeah.
the same either. And, lack of sleep and not fueling ourselves well, which is super, super common for mums,
Mhm.
really impacts our ability to exercise and our ability to recover from exercise
Yeah.
and recover from birth. So, yeah, being mindful of all of those factors to try and support your return to exercise.
Absolutely. I know we've spoken a lot around like pelvic health and prolapse, which has been fascinating. I feel like I've learnt so much from you today. But from a contrarian perspective of because we know we've heard the things any mum who's been in the fitness space for any iota of time knows like eat well and train well and get enough sleep and things like that. Is there anything that you would want to share that maybe is something that maybe a mum wouldn't have heard of? It's maybe not a popular um, tip or advice that you have found has helped you and the mums that you work with around her health and her fitness in general, like outside of
Yeah,
like pelvic floor and prolapse?
yeah, definitely. So, um, my my motto: anything is better than nothing. With
Yes.
a little caveat on that, but
Yeah.
a lot of mums are in that all or nothing mindset. Like I used to go to
Yeah.
the gym for an hour, 3 times a week. I can't do that now. They don't do
Might as well
anything. They're
not do
still trying to
anything.
get back to it. They're
Yeah.
still trying to get there. Oh, maybe next week I'll be able to get it. But in the meantime, you could be doing so much more. So exercise snacks, snack on exercise, right? So
I love
if
that.
you're doing your
Exercise
teeth, you
snacks.
can do some squats. You can do some calf raises. You can
Yeah.
march on the spot if you're waiting for the jug to boil. So it's
Mm, love that.
with exercise, I say just start with those snacks, and once you get moving, sometimes you're like, oh yeah, I'm feeling good. I could squeeze in a few more or do something else.
Yeah.
So it's you don't have to do it all, but
Mm,
just aim to do something. Aim to add a little bit more movement in your day. So it might be parking further away when you're at the shops. Like when you go to the supermarket, park at the furthest park away and then walk type thing. So it's just how can you add those little bits of movement that are going to support you to, and you know, you still might have those goals of getting back to the gym 3 times a week or whatever, but it's
mm,
better to do those little bits consistently. You're going to see way more progress if you do that than the odd occasion that you get to the gym, you know, every couple of months or whatever, you know.
yeah. Yeah.
And then the nutrition side of things, don't need any diets. Aim to eat healthier,
Yeah.
healthier. How can you, whatever you're eating now, how can you make that a little bit healthier? So if
Yeah.
you're having, I love cereal. I'm a cereal fiend.
Yeah.
If you're having cereal for your breakfast, you know, add a dollop of yogurt, add a piece of fruit. So
Mm,
just those little things to improve what your current nutrition is. And especially for mums in the early postpartum period, when people say, oh, you know, how can I help? Well, you know, can they cut up some fruit for you? Can they prepare some healthy snacks for you? Prepare some healthy meals? Because yeah, it's really hard to find the time to prep and cook healthy meals when you're in that phase. So, yeah,
absolutely.
when people ask them for help, then take them up on it. Say, here you go, here's what you
Absolutely.
need. Here's Karen's Nutrition for Mums Guide. Have a look at that
Yeah.
and see
Yeah.
how you can support me with that. So, yeah, it's the exercise snacks, and then how can you make your nutrition a little bit healthier. And over time, that will progress. And
Yeah.
you'll notice that when you look back in a year's time, oh, I no longer have cereal every morning. I might have cereal once every now and now I have eggs on toast because I know it fills me up better, and I know it. Do you know what I mean? So it's like,
Changes your taste buds even. You're like, oh, I actually want
yeah,
this because it tastes it like it
yeah.
fills me up and it satisfies me. Yeah.
You don't have to change everything all at once,
Yeah.
and especially when you're worried about baby sleeping and
Yeah.
teething and all the things like your mental load is just huge. So
Yeah.
you don't need to make big changes in this stage of life. Just do what you can consistently, and yeah, it's going to be better than nothing.
Absolutely. What would you say? Because I've spoken to a lot of mums who, and I don't know if your experience is similar. What would you say to the mums who just want to focus on like getting the aesthetic look back, getting, like the flat tummy back, or getting, you know what I mean, getting back to, I guess, how their body was like pre-pregnancy. What
Yeah.
would your advice be around that? Because I know we've spoken about like a lot of mums have like an all or nothing mindset. I see that a lot too with
Mm.
my clients too, and around dieting and things like that. Like, what would be your main advice that you would want to give a mum who's in that phase of like maybe she's just given birth, she's like, right, I want to, get back to this size, or I want to lose like, my belly or whatever it is. Like, what would
Yeah.
you
Yeah.
say? Yeah.
So that's a valid goal to have. And so I work with mums say, yep, sure, okay, we can start with that. But I often find when I'm in class, when I'm doing my PT sessions, we don't talk about that. When we're talking about how you're feeling, how your strength can help with your function and your daily life. So it's more I try and shift it away from the aesthetics.
Yeah. Yeah.
um, and also managing expectations, because like I said, so many other factors come in when you're a mum. So
Yeah.
that's cool, you've got that goal, let's work towards that. um, and they may want to do it in 3 months, and I'll be like, well, realistically, see, we might start off aiming for that, but then it's just changing those expectations as you go along. And
Yeah.
because everybody is different as well, some mums will have babies that will just sleep all the time, super easy, so they have more time, and this is the time that they can focus on themselves because they're not working. And then you get the other mums who have these really you know big goals.
Yeah.
Trying to get the right
Yeah.
word there.
Yeah.
Big goals, but it's just really impractical to get there in the time frame because of everything else that they're experiencing. So
Yeah.
yeah, it's about shifting that mindset, that those expectations, and yes, you can have that goal, the aesthetics goal, but my way of coaching kind of shifts you away from that, if that makes sense.
Yeah, it
But
does.
I
It does.
still feel like it's a valid, for a lot of people, it is a valid thing. But they, once they start, they see all the other benefits
I was gonna,
that they
yeah.
get from it. Yeah.
Yeah, it's almost like it's a very valid goal to have, but at the same time, for where your body's at and what you've just gone through, it's like your focus should be like saying the quiet part out loud. It should be on
Yeah.
like getting your strength up, pelvic health, like getting your like yeah, getting you feeling good within yourself
Mm,
and all the health benefits and the fitness benefits first. Doesn't mean that you're not going to get to whatever aesthetic goal that you have, but especially just like right after birth and getting cleared for exercise, that shouldn't be the main focus. Dieting shouldn't be the main focus.
mm,
Like your body needs to be nourished well. You shouldn't necessarily be like on super low calories or trying to be, doing any of
yeah.
that. That's kind of yeah, just
Yeah.
setting being we're both being real with you. It's just about like having realistic expectations that support your health and aren't gonna
Yeah, that's right.
run you and your body into the ground and put you in an even worse position, essentially.
Yeah, and when you've got that different mindset around supporting your body better,
Yeah,
just working towards healthier and function as opposed to how it looks, you can
yeah.
still get to that aesthetics goal, but
Mm,
you're in a way better mental state to get there because
yes.
you're
Yeah.
not counting calories, you're not focusing on, I ate a biscuit today, now I have to go out, do an hour's walk or something. Do you know what I mean? Like it's just when you're able to manage those expectations and shift that focus, they can
Mm,
still get to that goal that they want, but it's a much healthier, more sustainable way of getting to that point. But I've had many people, their role form says they want this, but
mm.
they never get there. I've had like one client comes to mind. You want to lose a certain amount of weight. They never got there, but all the other benefits that they've just stuck with me for ages because they're like,
Yeah.
well, actually, that's not as important anymore. I know I'm stronger. I know my pelvic floor is good. So
Yeah. Yeah.
it's
And it's
that
something
shift.
they
But
can
that's the
only
tricky, yeah. We're ingrained from how we grew up that we need to be smaller,
yeah.
we need to be super fit, all these things. We need to diet, and so yeah, it's about working with mums to help shift that.
Yeah, and kind of almost
Yeah,
heal your relationship with your body a little
yeah,
bit because especially if you've just
yeah,
given birth, like that's an incredible thing that your body's just gone through. Like the fact that it's
absolutely.
to carry your child for 9 months, like,
A
and so
big thing, like a massive change to your body.
yeah, absolutely, absolutely. And so it's like, like giving yourself and giving your body some love
Yeah,
and self-respect to yeah,
that's it. Yeah, definitely.
healthy and be healthy and strong and yeah, like we say, we're not invalidating anyone's aesthetic goals, but it's doing it from a place of self-love
Yeah,
as opposed to self-loathing or
absolutely.
yeah, and doing that. That's incredible. That's incredible. Oh, Caren, it's been so incredible to have you on the podcast today. Is there one piece of advice or um, anything that we haven't covered yet that you would love to end with, that you'd love to share with any woman listening to this right now?
Um, I mean, we've covered a lot, haven't
We
we?
have. We've
To
covered
bring
so
it
much.
back to one thing, I think I'm going to say that self love
Mm,
and self respect, and um, because we can be so up in our heads about everything and comparing to others, and you are unique, you're individual, your journey is your journey.
mm.
So just being kind to yourself and seeking out the support that's going to help you get to where you want to go. So, yeah, I think that, we have too much, mum guilt and all that stuff.
I do,
We put too much pressure on ourselves for everything. So, yeah,
yeah.
education, seek out the help and support that you need. And, yeah, give yourself that grace to, you deserve to be looked after and get that support as well.
Yes. I love that. I love that so much. Yeah, I think every mum deserves to make herself a priority in some way, shape, or
Yep.
form. It doesn't mean absolving your responsibilities, obviously, but
No, that's
you
right.
deserve to
Yeah,
prioritize yourself and give back to yourself. I love that. I love that, Caren.
absolutely.
Thank you so much for being on the podcast today and sharing all your wealth of knowledge with us. Really appreciate it. For those that want to check out Caren, I'm going to be putting Caren's website, social links, everything. So everything that Caren talked about around your free guide. You said you had a guide that you just put up
Yep.
as well. I will put it in the links in the show notes so you can go there and check Caren out there. Caren, thank you so much for being on the podcast with us today.
Thank you so much for having